Surgical site infections are an important and frequent complication of surgical procedures. The appropriate preparation of the surgical site is an important step in infection prevention. It involves the disinfection of the skin before incision. The aim of this procedure is to reduce the microbial load on the patient's skin as much as possible before incision of the skin barrier. Essential requirements for appropriate surgical site preparation are: 1. It should be performed in the operating room immediately before draping and incision. 2. Sterile equipment, instruments, and swabs should be used. 3. An appropriate sterile disinfectant solution should be used. WHO recommends alcohol-based antiseptic solutions as they are more effective than aqueous solutions, and alcohol-based antiseptic solutions based on chlorhexidine gluconate are preferred. The area to be covered should not only include the immediate site of the intended surgical incision, but also a broader area of the patient's skin. Bathing or showering with either plain or antimicrobial soap before any surgical operations should be performed separately outside the operating room. We do this to protect the patients.
The patient's skin is already clean as the patient had a shower preoperatively as instructed, and no hair removal was performed or required as per WHO's recommendations. The nurses enter the OR and don sterile gloves. The nurse prepares by first opening the sterile pack and organizing the work area, by creating a sterile field, arranging the sterile instruments, tray and swabs onto the field, and pouring the appropriate skin antiseptic solution into the bowl. An alcohol-based solution containing chlorhexidine, which is a long-acting substance, is recommended. Be sure to use an alcohol-based antiseptic as they are more effective than aqueous solutions. Surgical site skin preparation should be performed immediately before draping and incision for the surgical procedure. Skin preparation should begin from the center of the incision site and move outwards, maintaining an aseptic technique. The area to be covered should not only include the immediate site of the intended surgical incision, but also a broader area of the patient's skin. Be careful not to touch areas that are not part of the preparation area. Dispose the used swab in the waste bag. This step should be repeated with new sterile soaked swabs until the full area is prepped. This will depend on the patient and surgical site. If contact is made with an area not part of the preparation area, stop skin preparation and immediately dispose of the swab in the waste bag. Obtain a new sterile soaked swab from the trolley and complete the skin preparation following the same aseptic technique. Ensure there is no pooling of antiseptic solution underneath the patient. Ensure sufficient time for adequate drying, as time of drying means time of antiseptic action. Clear and dispose material used for skin preparation. The assistant should document the date and time, the area prepped, the patient's skin condition, and that there is no pooling of fluid under the patient.
Patients would wish to receive this skin preparation in order to reduce the risk of surgical site infection. Staff in the operating room should apply this practice safely and before every surgical procedure to protect their patients in the operating room.